1988, when community health began in Kenya. It is the first time that organizations, that policymakers are gathering in Kenya to talk about a community health worker in a digital platform. I remember in 2020 February, when I was in Thailand, Bangkok, I talked about paying community health workers. And somebody asked me, who is this community health worker? Because they don't even appear in the system. When I Google, I don't see any name of a community health worker. And in 2021, the process of digitalizing community health started by community health workers having been put in a master list. And the process has been going on and on. And in 2023, the president gave all the 107,000 community health workers smartphones so that we can start to transmit data digitally. We used to transmit data using pen and paper. I remember sometimes when my paper could get lost and using my memory sometimes giving wrong data. But right now, we are on the right track because we have electronic health information system. So data is being collected electronically in Kenya, and that is very, very positive, both for the community health worker and the communities in our country. I take this opportunity to thank Dimagi team, because Dimagi, when we started communicating with Dimagi as a national association, we had partnered to make sure that the community, the children below 5 years, are all getting the vitamin A and are all being dewormed. And Dimagi introduced Home Care Connect to the community health workers in Kenya. And because of that, in Africa, I am so happy because Dimagi has reached 1 million African children who are below 5 years. What does that mean to you? What does it mean to me? It means that African children are going to live longer because they're going to be healthier even beyond 5 years. We know that health starts at conception, and it is very important for the first 5 years of your life. And Dimagi makes sure that this African child gets immunized, gets vitamin A, and gets dewormed, and that is saving lives. So about 1 million children right now have been dewormed, have been reached out to make sure that these children are not malnourished, and if they are, the community health workers are able to reach out to them and refer them to the Ministry of Health so they may get help. I want to thank Community Health Impact Coalition for making sure that community health workers are able to professionally advocate for our pay. When we joined the Community Health Impact Coalition and started doing the advocacy training, we presented our memorandum in the Parliament in 2023, and it was positively received. And the Parliament discussed about paying community health workers and professionalizing community health workers. And the President signed it to be a law that the community health workers should be recognized as part of the Ministry of Health. And because of that, everything is happening digitally. 17 county chapter leaders of our association sat down and presented this will not end in this room. We expect results even beyond, and to know when we reach 2030, I believe that we are going to be so advanced. I myself, I desire to know more about artificial intelligence. And it is you people, the experts who are here, you are the ones who are going to train the community health workers to know more about digital health. And this is not only because we want to know about digital health. We know that digital health saves lives. If ComCare can make sure that 1 million children are reached to save their lives, it means that digital health saves lives because it saves time. So when we save time, a life of a child is saved. A life of somebody who is suffering from high blood pressure is saved. Only this year, in Kenya, more than 50,000 people never knew they are suffering from diabetes. More than 100,000 people never knew that they are suffering from high blood pressure. But because the digital tools we had, they got them tested, they were aware that they are suffering from high blood pressure, and they were able to get help. So, in my opinion, digital health is the way to go, because more lives are being saved right now. So as we celebrate, we should not celebrate beyond fifth. We should not celebrate only by fifth. We should go beyond fifth. We should ask our question. In 5 years from now, what will have been improved? What were the milestones? What were the challenges that we had? So 5 years down the line, let us expect to see that there is 100% improvement in results from the community to the healthcare workers. Thank you so much, and celebrate.